Folic acid is an important nutrient for women to take before and also during pregnancy in order to prevent neural tube defects in the baby. In fact, it's so important that we get this nutrient that governments even make sure to fortify flour with folic acid so that it's available in any bread that we eat. But recently, some new research came out of my very own country, Australia, that seems to have found that having very high levels of folate during early pregnancy is linked with higher rates of gestational diabetes. Pretty unexpected finding for me. I was a bit surprised to run into this, and I'm sure many other women would be too, because folic acid is considered probably the most important nutrient for us to take during pregnancy. And naturally, this is going to bring up questions like, do I need to stop taking my folic acid supplement? How much is too much? What is going on? And so today we're going to try and answer those questions. So let's go. Let's start with talking about gestational diabetes. Now, gestational diabetes is a type of diabetes that develops during pregnancy. So it tends to go away after the baby is born, but that doesn't make any of it less of an issue. If a woman develops gestational diabetes, then she is more likely to develop type 2 diabetes later on in her life, and the baby will also have an increased risk of developing type 2 diabetes later in its own life. Here in Australia, usually between 24 to 28 weeks of pregnancy, you would get screened to check if gestational diabetes is present. So you'll do what is called an oral glucose tolerance test. It's the test that involves you drinking a very sweet drink, and what they do is they check your blood before you have the drink and a couple of hours after to see how your body is dealing with this big sugar hit. But basically, if those blood tests come back with higher blood glucose levels and you didn't have any diabetes before the pregnancy, then you'd be diagnosed with gestational diabetes. And it actually tends to be managed with lifestyle changes like diet, physical activity, all the things that we talk about on this channel. But if it is quite severe, it will be handled by your healthcare team and some medications may be added into. Now, the thing with gestational diabetes is that the rates of people experiencing this are increasing. In fact, it more than tripled during the years of 2019 to 2022. So it went from 5.6% to 19.3%. That's just 12 years, so that is pretty extreme. And so naturally, researchers want to figure out why this is happening. And there's already a few things that we know of that can increase the risk of someone experiencing gestational diabetes. I will pop them up on the screen now. But you can see here having a family history of type 2 diabetes, experiencing obesity, being pregnant at an older age, your ethnicity also makes a difference. If you have PCOS, lots of things increase the risk. But the study that we will be talking about today, it looks specifically at folic acid. And a big reason that they are looking into folic acid is because if we look at this graph here that shows the rates of gestational diabetes, that red line is when the fortification of bread became mandatory in Australia. And it seems to line up with when the rates of gestational diabetes started to increase. And so here is the study here. The link to it will also be in the description, so you can check it out yourself if you want. But the researchers looked at two groups of pregnant women who went to the same hospital in South Australia, but in two different time periods. The first group was before Australia started adding folic acid to bread flour, and the second group was after fortification of bread flour. So that was about 6 to 9 years after that happened. And so early in the pregnancy, these women had blood tests done to measure folate levels and also some hormones from the placenta, which were HPL, GH2, and prolactin. Don't worry too much about those. I will explain these a bit later on. But these are hormones that affect how insulin works during pregnancy. They then followed these women to see who went on to develop gestational diabetes and who didn't. And what they found was that group 2, the ones who were pregnant after the fortification of bread flour happened, they had much higher average folate levels, and more women in this group had what was considered high folate. So if we're looking at this group, those women who had the higher folate levels ended up being more likely to develop gestational diabetes. So for example, there were about 297 women in group 2 who had high folate levels, and 18.5% of them developed gestational diabetes. If we zoom out a bit actually and just compare the two groups, group 1, which was before the fortification, 5% of women in this group developed gestational diabetes. But group 2, the group that was after the fortification of bread, they had 15% of women develop gestational diabetes. So something clearly was different between these two groups, and it seems to be their folate levels. Now look, the study isn't perfect, and we need to remember it's observational, so we can only see associations here. There is nothing causal. The study is not saying that high folic acid causes gestational diabetes, but there does seem to be a link. This also isn't the only study to find this. There have been others too that looked into excessive folic acid supplementation, which also was linked to higher rates of gestational diabetes, but again, they're all observational studies. Now, what I do want to focus on for a little bit is how exactly having too much folic acid could lead to gestational diabetes. So during pregnancy, your body will actually naturally become a bit more insulin resistant, meaning that insulin doesn't quite work as well, and this causes blood sugar levels to rise. This is fairly normal, and it's because of the hormones that get released from your placenta. So I did mention them before, but they are GH2, which is placental growth hormone, HPL, which is human placental lactogen, and prolactin. Now, all of these hormones are important for pregnancy, but they can impact on blood sugar levels. Now, what the study that we talked about did find was the women that had very high levels of folate, they also had higher levels of this HPL hormone and prolactin. And if we just look at the group 2 women in general, again, this is the group that had pregnancies after fortification of bread with folic acid. In general, these women had higher levels of GH2 and HPL. So what folic acid might do is impact on these hormones and push their impact on blood sugar a little bit too far. Now, this isn't quite confirmed, and I'm sure there's a few ways that folic acid could cause or lead to gestational diabetes, and I am no expert in that area, and it will definitely need a bit more research. So do we still need folic acid supplements during pregnancy? At this stage, the answer is yes, but the amount is important. So folic acid is essential during pregnancy. We need it to prevent neural tube defects. It's also needed for the growth of cells in general. Making sure women got enough folic acid was a huge win for public health because it prevented many babies being born with these neural tube defects, which can impact the brain and spinal cord. So not having folic acid is not a solution here. The current advice and guidelines say that women need 400 micrograms of folic acid daily when trying to conceive, and also throughout the first trimester, which is about 12 weeks. But since 2009, breads have been fortified with folic acid, so the baseline of what people get may be higher. And add to that the fact that prenatal vitamins tend to have more folic acid than is needed. For example, Elevit is one of the most commonly used brands in Australia for prenatal vitamins. It actually has 800 micrograms of folic acid, which is double what the guidelines say we need. And so it could be that we are overdoing it. Now, I personally find the prenatal multivitamins way too large, the actual tablets. And so for my folic acid, I just take a small 500 microgram tablet. It only has folic acid, there's nothing else in it. That's just me. I avoid multivitamins. I just take single nutrients that I might need. But if you are worried and you're really unsure about this, you do need to talk to your own doctor about whether you're taking too much or whether you need to take a lower dose supplement. Every person is different, and you need to talk to the medical professionals that know your situation. This study, it gives us important information, but it's not information to go around changing guidelines. So we just need to be informed and make decisions from there. Now, if you have any questions or anything you want to see a video about, then please leave a comment. I will see you in the next video, and until then, keep playing the long game.